Hello, I am Karthik, a psychologist and a clinical hypnotherapist. I specialize in anxiety and depression. I am going to tell you 5 things people do when they get anxiety. And the last one is unbelievable. First thing is, even if a doctor suggests them to take medication, they don't ask, are there other options without medication? They blindly start taking medication to treat the symptom and they depend on it. But for how long? After some time, they realize that no matter how long they take that medication, they are unable to come out of it. Actually, that medication is making them dull. It doesn't mean that the issue is gone. What people think is when the medication makes them dull, they won't be getting these negative thoughts. Yes, they won't be getting these negative thoughts. They won't be getting other thoughts also. And they think, the medication is working its miracle. I'm cured of this anxiety. But what harm that medication is doing to you and how dependent you are becoming on that medication. There will be psychological dependency and physical dependency on the medication. After some time, if you keep on taking that medication for longer periods of time, the effect of that medication decreases. And you need to increase the dosage or change the medication. With increased dosage, increase the side effects. If you would have tried to come out of it naturally, you wouldn't have all these complications. See, medication should be there as a last option. People straight away just want to take the medication, the immediate fix they think. But they don't realize what damage they are doing to their brain and their body. And another thing is, people who are suffering from anxiety and depression, they don't have patience. They expect immediate results. The doctor or therapist accordingly gives them that medication or the therapy. Then they don't have that patience to continue that. Immediately, again they go to another doctor. Why? Because the person who understands your issue will be understanding you more. People find the cheapest therapist, and usually the cheapest therapist would give a generic therapy that person gives to everyone. They don't customize it according to you. Then the change won't happen. Your subconscious mind develops immunity to the therapy. Once your subconscious mind develops immunity to the therapy, and it will no longer be effective. Why? Because earlier the ineffective therapy that was given, which was not effective enough to make the change in your conscious or subconscious, now in fact your mind has developed immunity to the therapy, especially in hypnotherapy, will be no longer effective for you because of it. I have several of clients coming to me and telling me that they have went to this hypnotherapist, that hypnotherapist, a result did not come. I directly tell them, see, for you, hypnotherapy no longer works. We need to use other modalities to make you come out of it. Why? Because consciously there will be very strong belief system developed for hypnotherapy. Then no matter how effective the therapy is, the result won't come. Another mistake is finding a great doctor, getting fixated to the person treating you. Some people stick to that therapist no matter how much time. Even after some people come, I'm going to this doctor, he is the gold medalist and he's having that, he's having this, he's so accomplished. And I ask them, how long are you going to the doctor? They tell me, okay, few weeks, months, years also they'll be continuing without any change. In some cases they will be going to that doctor for months and without getting any result. Even after 6 months from now or 1 year from, they're not getting any result. If you are not getting result, why you need to stick to that doctor or therapist? See, if the therapy is good, you will get results immediately. If the therapy is ineffective, it takes long time. Even some cases few weeks, some cases months, some cases years also. If the therapist is good, only in few sessions you can come out of it. Going immediately for meditation or yoga. See, if you were practicing yoga and meditation earlier, that is fine. It will be helpful for you in this condition. If you get anxiety and depression and immediately you go for yoga or meditation, it will be very difficult. Even for normal people to have that concentration and focus to do meditation becomes difficult. Even for normal people, it takes a long time for them to get accustomed. Some cases they take months, some cases a year also to get accustomed for that meditation. It is like as a doctor suggests, whenever you want to be healthy, you need to exercise, you need to go to the gym. We hear, if you want to be healthy, you have to go to the gym and do the workout, then only you will be healthy. That's what we always hear, to have a healthy lifestyle and everything. But once you get a disease, some other disease, if you go to a gym, that disease won't go away. So let us assume that someone gets diabetes. If the person goes to the gym, the diabetes does not go away. Earlier, if before you get the disease, you go to the gym and maintain your healthy weight, then chances of the disease coming to you decreases. But once you get the disease and you go to the gym and try to come out of it, is very difficult. It's very difficult. First thing is, you have to take that medication or that medication and the treatments for that, and then you go to the gym and try to come out of them. That is another thing. Immediately, the result won't be immediate. Gym is not like magic. Gym or exercise is not like magic. Immediately, few days or few weeks, you do the workout, immediately your body composition changes and you change. It takes long time. Some cases even it depends how much time you abused your body. Whether you abused your body for 6 months or 1 year or 5 years, and immediately you go to the gym and think that your body is going to be changed and you are going to be healthy. Going to the gym is not a treatment for you. You are having anxiety or depression. If before, it is like a complementary, where whenever you take a therapy to come out of anxiety, I am talking about serious anxiety cases. I'm not talking about people you are feeling for anxious for a few days or weeks or 2-3 months, 1 or 2 months. That is not a major issue to be concerned. You just change your lifestyle and decrease the stress and exercise, that will be fine. But if you are having anxiety or depression for more than 6 months and it is increasing, it is not like after 6 months slightly it is decreasing. No, it is slowly increasing. The intensity is increasing. Then you have to first address that issue. Why is this anxiety increasing? Don't focus on the symptom. Focus on the root cause. Why is this increasing? Most people focus on the symptom. Okay, I'm feeling anxious. I'm feeling my heartbeat is increasing and my hands and legs are shivering whenever I get anxious. So I take medication for that one. Once I take medication, I'll be fine. So you have not addressed the root cause. Why this anxiety is coming? You should be focusing on that one rather than taking medication to momentarily reduce that anxiety or panic attack you are getting. The moment you start depending on medication, your body depends on that only. Next time to come out of that anxiety depression becomes far more difficult than if you have not taken that medication. And this is a strange one. You won't believe. People think that they can become a therapist. Why? Because they had done the research so much and they already have that anxiety. So they know better than anyone. So they start treating. They want to become a therapist. And in that process, they can treat themselves. This is the unbelievable thing. See, if you want to become therapist, you can become therapist. There is nothing that's stopping you to become the therapist or nothing bad about it. The thing is, when already you suffered with anxiety or depression and you are learning about anxiety and depression, and if someone comes with anxiety and depression and explains their problem to you, immediately it triggers. Even the anxiety that you thought that it is gone, it is going to trigger. But you can become therapist for other issues like ADHD, other disorders, other issues, you can deal with it. Why? Because it is not related to the thing that has affected you. It is like, imagine a person who is an alcoholic who came out of that addiction. He is always more susceptible than the person who is a non-alcoholic. Even a person who left that addiction of alcohol for 5 years or 10 years, they are more susceptible to drink alcohol than a normal person who does not have that problem. Even after 10 years, all it takes is one glass. Again, they come back to their addiction. And this time, it becomes even more serious. They think, okay, let us try one glass. So, same way, for you also, even if you come out of anxiety and depression, and if you go into the path of treating or helping people with anxiety and depression, I'm not saying not to help them, but don't take their issues, don't listen to their issues. The moment you start listening about anxiety and depression, you don't know why it triggers in you. So this is the unbelievable thing people do. I have seen several people doing that. That's why I'm telling you, try to do it. So you choose another process where this is not related to anxiety or depression. I have several of my friends who came to become a psychologist, who wants to become. Most of them are having psychological issue. That's why they think that after becoming a psychologist, they can treat themselves and they can help others also. But this is a very wrong concept. You must have also seen several psychologists and therapists. They are having several issues. You think, as a therapist, that person should not be having those issues. But extreme anger, extreme rudeness. Why? Because it is their psychological issue triggering out.